Sophie, how are you?
I'm good. How are you?
I'm good. My name is Dr. Mad, and I'm the hospitalist here. So I'm going to do your examination before tomorrow.
Okay.
Hopefully you're going to be discharged. Let's make sure that everything is in order. Can you please verify your last name and your date of birth?
Yes, last name is ASMR. Date of birth is August 25th, 1992.
Okay, perfect. So you came here with back pain and neck pain after a strep infection?
Yeah.
And are you having any pain right now?
Barely. It's almost gone.
On a scale of 0 to 10, how would you rate it?
I would say maybe a 1 or 2.
Okay. And when was your last pain medication?
I don't think I've had pain medication since a couple of days ago.
Okay. So I see here you are on antibiotics, Unicef, every 6 hours, which is good. And also on Decadron, every 8 hours, twice a day. Okay. Now go ahead and take your vital signs. Are you experiencing any blurry vision, any tingling sensations in your pins and needles in your fingers or feet?
No.
Okay. Okay. Is it okay if I do it on this arm?
Yeah.
Okay. Any chest pain, any palpitations?
No, not really. I'm actually feeling pretty good.
Okay. Okay, go ahead and relax. I'm also going to take your temperature. 97.9. Okay, heart rate is 101/69. That's good. Oxygenation 97 percentile, room air, heart rate is 85, and MAP is 80. Good. Okay, so let's slide this down. Okay, I'm gonna go ahead and listen to your heart, okay?
Okay.
Is it okay if I put the stethoscope on your shirt? Okay, just breathe normal. Normal heart rhythm, S1 and S2 heard, no S3, no S4. Can you please take a deep breath in? And breathe out. Again, take a deep breath in. And breathe out. Is it okay if I listen to your lungs in the back? Okay, take a deep breath in. Breathe out. Again. And exhale. One more time. Exhale. Okay. Normal heart rhythm. And no signs of atelectasis or pneumonia. Any coughing while you were here in the hospital?
No, not really.
Okay. Alright, so as I'm looking at your overall appearance, you seem to be very relaxed. Skin looks very well perfused. I'm not noticing any cyanosis around your mouth. And no scratches, no redness, no signs of any eczema. Is it okay if I palpate your head?
Yeah, sure.
Okay. Okay, I'm not feeling any bumps. Head is symmetric. No tenderness. And is it okay if I palpate your neck in the front and the back?
Yeah.
Okay. Let me know if you feel any pain as I'm doing this. I'm going to have you turn your head this way. I'm also checking your lymph nodes. They seem less swollen than when you came to the ER. That's good. Skin is well perfused. I'm not feeling any swollen lymph nodes. No redness. And no tenderness. Okay, I'm gonna go ahead and check your other side now. Okay, some mandibular nodes are non-inflamed. Normal temperature of your skin. Cervical lymph nodes also look good. Normal size. Mastoid bone is non-inflamed. Okay. The thyroid gland is also normal size. Can you please swallow for me? Okay. I'm not feeling any nodules, and the trachea is midline. Perfect. Okay. Is it okay if I check your sinuses?
Sure.
Okay. Okay, so first I'm palpating the ones above your eyebrows. Okay, and I'm gonna go check in your hairline. Make sure that I'm not feeling anything abnormal. Good. Temples. Preauricular. Jaw. Okay, and I'm going to palpate your eyes as well. I apologize for my big gloves here. tenderness there. I'm not feeling anything swollen and no puffiness. Can you please breathe in, breathe out through your nose? There again. Okay, so both nares are patent. Okay, as you keep your eyes closed, I'm going to ask you to try and lift your eyebrows. Okay, good. And now try and open your eyes. Okay, good. And can you please push your jaw to your left? Okay, good. And now to your right. Okay, perfect. Can you please shrug your shoulders? That's good. Relax. Okay, can you please look down? Okay, good. And now go ahead and look up. Okay, relax. I'm going to make some movements with your head to check how mobile your neck is and if you're feeling any kind of pain. So I need you to relax your head and tell me if you feel any kind of pain as I'm moving it, okay?
Okay.
All right, so first we're gonna look down. Any pain anywhere?
A little bit.
Okay, where is
in
it?
the middle, base of the skull.
Over here?
Yeah.
It does feel a little bit inflamed. I'm feeling some puffiness, but no nodules. I think we're gonna go ahead and order a CT after this to check for any cellulitis. Okay, now same thing, relax your head. I'm going to lift it up. Any pain anywhere?
No, not really.
Okay, and now I'm gonna have you touch your left elbow, left shoulder. Any pain there?
A little bit. It feels kind of like on this area.
So you feel the pain here.
Mm-hmm.
Okay, let's go ahead and check on the other side. Any pain?
Same thing.
Is the pain still here?
Mm-hmm.
Okay. Yeah, so I think it would be best to order that CT, and we're gonna make it stat. All right, I'm gonna go ahead and check your arms and your hands. So I'm just going to open this a little bit, and I'm going to start from the shoulder. Relax. Is it okay if I palpate your armpit?
Mm-hmm.
Okay. Okay, no signs of any swollen lymph nodes. Okay. I see you have a scar here.
Mm-hmm.
Looks very old.
Yeah, it's
Okay.
been at least 10 years.
Normal skin perfusion. No edema. Okay. Flip. Okay, now I'm going to check your hands too. I'm seeing some bumps here. Have you ever had these like for a long time or they just appeared?
No, I've had them for a long time. They're
Okay.
scars.
Okay. No concerns there. Capillary refill is within 2 seconds. So very good peripheral circulation. Okay. No palmar erythema, so no bile problems or liver inflammation. Also, no edema in the hands or the fingers. Okay, I'm going to perform a pinching test to check for any signs of dehydration and malnutrition. Is it okay if I palpate your armpit?
Yeah.
Okay, very good. Okay, go ahead and relax. Normal skin color, good peripheral circulation. No signs of dehydration. I'm taking capillary refill. Everything looks very good within 2 seconds. Palms have very good pinkish color, no redness. No edema. Okay, very good. Okay, I'm gonna go ahead and check your eyes now.
Okay.
So what I'm gonna need you to do is to look right here straight at my fingers, and I'm going to shine a light in your eyes. It's going to be a little bit bright, but just for a few seconds, okay? Are you wearing contacts?
Yes.
Okay. Go ahead and look straight. Okay. And I'm going to push down on your eyelid just to take a look, see if there is any yellowish discoloration. That's good. Okay. That's good. Can you please follow my fingers with your eyes only? Don't move your head. Okay, and now I'm going to ask you to look straight at my nose. Very good. And I'm going to need you to cover your right eye, for example. Okay, and I'm going to do the same thing. I'm going to cover the opposite one. I need you to tell me when you see my fingers in your field of vision, okay?
Okay. No.
Okay.
No.
Okay.
No.
Okay. Same thing on the other side. Go ahead and switch.
No.
Okay.
No.
Okay.
No.
Okay, very good. Okay, now can you please tell me which fingers are moving, right or left?
Left.
Okay,
Right.
good.
Left. Left. Both. Both. Left. Left. Right. Both. Right. Both. Both. Left. 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 Right. Both. Both. Right.
Okay, perfect. Go ahead and cover one eye for me. And with your other hand, can you please hold this card?
Mm-hmm.
Okay. And can you please read this sentence?
And I am your housekeeper today.
Okay. Go ahead and switch eyes. Can you please read the last sentence?
Provide extra blankets, pillows, and fresh linens.
Okay, very good. Thank you for that. I'm going to go ahead and check your optic nerve now. I'm going to need you to keep your eyes open as much as you can. And can you please look behind me straight at the wall?
Okay.
All right. Okay, very good. Keep them open. Excellent. Okay, so go ahead and do the same thing. Okay, very good. So I couldn't see any scratches behind the retina and no signs of inflammation.
Okay, that's good.
Yes. All right, I'm going to go ahead and check your tonsils. They were super inflamed yesterday.
Yeah.
I'm gonna need you to give me a big ah. I still see a little bit of redness, but no signs of that kind of infection that we saw yesterday, so that's good. Now we're gonna have to do another swab of your tonsils. Is that okay?
Mm-hmm.
Okay. All right, so I'm going to use both of them, and it's going to be for just for a few seconds. I'm gonna need you to give me a big ah, okay? Go ahead and check your nose. Go ahead and look up. A little bit of mucus and some redness. Same thing on both sides, but no increased inflammation compared with yesterday, so that's good. Okay, I'm going to check your facial sensation. Can you please close your eyes for me and tell me if you feel this?
Yes.
Okay, did you feel this?
Yes.
And what about this?
Yes.
Did you feel that equally on both sides?
Yes.
Okay. Now I'm going to check how your brain receives the painful stimuli and also the dull stimuli. And I'm going to touch you with two different textures. One is going to feel sharp and one is going to feel dull. I'm going to need you to tell me if you feel sharp or dull. So this is what sharp is going to feel like. And this is what dull is going to feel like.
Okay.
All right?
Dull. Sharp. Dull. 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 Sharp. 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 Dull. 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 Sharp. 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 Dull. Dull. Sharp. 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 Dull. 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 Sharp. Sharp. Sharp.
Okay, very good. And I'm going to go ahead and palpate your ears.
Okay.
Any pain as I'm pulling them up?
No.
Any pain as I'm pulling them back
No.
or down?
No.
Good. I'm not feeling anything. Okay, very good. And as you keep your eyes closed, can you please tell me with which ear you hear this sound?
Mm-hmm. Left. Right. Both.
Okay, now tell me which position here is louder. Position number 1 or position number 2?
1.
Okay, same thing, position number 1 or position number 2?
2.
Okay, again, position number 1, position number 2.
1.
Okay, very good. Alright, I'm going to go ahead and check your tympanic membrane. Good. Can you please turn your head this way for me? Thank you. Tympanic membrane is pearl gray. Just a little bit of earwax, which is very healthy. Good. No signs of infection. Okay, I'm gonna go ahead and check for any fluid buildup behind your ears. I'm gonna need you to tell me when you don't hear this sound anymore, okay? I'm going to bring it very close to your ear. Tell me when you can't hear it or can't feel it anymore.
I can't.
Alright, let's go ahead and try that one more time.
It stopped.
Okay. Can you hear it now?
Yes.
Good. Same thing. Tell me when the sound stops.
It stopped.
Okay. What about now?
No. It stopped.
Can you still hear it?
Yeah.
Okay, good. All right. Now I'm going to have you lay down and I'll examine your abdomen and then your legs.
Okay.
And I'm going to go ahead and percuss. Okay, very normal sounds. And I'm going to go ahead and palpate. Let me know if you feel any kind of pain.
Yes.
I'm feeling for enlarged organs, any masses. So first I'm just doing a very gentle palpation and then I will do a more deep one. Okay, I will put my fingers underneath your right side of your ribs. Let me know if you feel any kind of pain. I'm trying to feel your liver. Make sure that there is no inflammation. Okay. Okay, good. And now I will do a deep palpation. Okay, perfect. Okay, I'm going to go ahead and just uncover your right leg. Okay, and I'm going to just palpate, make sure that I'm not feeling any nodules. Good. 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 Okay, and I'm going to check behind your kneecap for anything swollen. Okay. Very good. And I'm going to make some movements with your legs. Let me know if you feel any kind of pain, okay? Any pain in the back of your spine?
No.
Okay. And I'm going to bend it. Any pain here? Okay. And now I will palpate your lower part of your legs. And I'm feeling for any warmness, anything swollen. Good. Okay, I'm checking your pedal pulses. Dupla, strong and symmetric. Okay, very good. Can you please try and lift your right leg up? Okay, good. Put it back down. And now your left. Okay, good. And can you try to do that with the both legs at the same time? Okay, good. Can you try and push it down? Good. Again. Good. And now, same, both in the same time. Okay, very good. Can you please push with your pads? Okay, and now pull towards you. Very strong. Good. Very good. Capillary refill is within 2 seconds. No edema. No pitting edema. Okay. Normal temperature as well. Okay. Is it okay if I examine your back as well? Okay. I'm going to go ahead and open your gown here up. And I'll palpate your spine and your neck again. I'm noticing that there is a little bit of swellness here in the upper side, but it subsides as I'm going down. Okay. Okay, you can go ahead and breathe normal. Okay, I'm going to go ahead and take a few measurements. So that's 41. Just trying to see if there are any signs of inflammation, asymmetry. Okay. Okay, very good. And I'm going to go ahead and tap on your back. Let me know if you feel any kind of pain. Okay. There is definitely less swelling compared with yesterday's exam. Okay, I'm going to have you sit up now, and I'll explain what's going to happen tomorrow. All right, well, the exam was relatively good, which means that you are progressing towards where we want you to be. Tomorrow we're planning your discharge. Okay. And we're going to run a CT tonight, stat, just to make sure that there is no infection still going on the posterior back. And at 5 a.m. we're going to draw some blood. You're going to check your CBC and your CAM panel, just to make sure that you are, getting better. And I'll come in around 9 a.m. with the other attending to discuss the treatment plan and just make sure that you get home safely.
Okay.
Do you have any questions for me?
No, I don't think so.
Okay, wonderful. So I'll let you rest now. Let us know if you need anything, if you're having any pain or anything like that, okay?
Okay, thank you.
You're welcome.
Bye.
Very nice to see you again.
You too.
Bye. Okay, hold on. I'm going to go ahead and put gloves on. And go back to that. Take a look at your back. Let's go ahead and put your hair up. I read in your file that you're having some increased pain on the left side in the middle between the shoulder blades. Just going to examine your spine first and see if there's any signs of immobility. So I'm going to try to move your vertebrae a little bit and see how much space is between them. Feeling for any pulsations and see if there's any abnormal curvature. Okay. Taking a look at C1, your atlas. C2, axis, and moving down. Checking your scapula for any signs of luxations. Okay. I'm not feeling anything abnormal. There's no signs of inflammation. Just feels very tense on the left side. And definitely less normal than the right side. I'm going to take some measurements to compare. Make sure that there's no inflammation. gonna go ahead and start working on increasing mobility on the left side. Also, this will help to restore blood flow and decrease muscle tension. It's gonna feel like skin pulling, so I'll be pulling the skin up and slowly releasing it. Okay, I still feel a knot there. So we're gonna try to work on the area until the muscle smoothens out a little bit. To work on the muscles next to the spine. They're gonna help to relieve some of the inflammation. Okay, I think we're going to go ahead and do some adjustments. Okay, go ahead and take a deep breath in. Breathe out. Okay. And again, take a deep breath in. And breathe out. And again, take a deep breath in. And breathe out. Okay. And again, breathe in. And breathe out. One more time, take a deep breath in and breathe out. Okay. Go ahead. Apply some oil to massage the sore muscles and increase the blood flow to these areas. Focusing on the shoulders first. This is going to feel cold. You okay? It feels a little bit cold. Okay, moving down the spine, so you're going to feel that coolness and it's going to relieve some of that tension and pain. Just doing some deep tissue here, making sure that we're activating the lymphatic drainage as well. Okay, we're going to perform cupping therapy. This will increase blood flow in between your shoulder blades. You're going to have a little bit of redness on this area, but it should go away within 24 hours. Does it hurt? Okay, this will apply multiple pressure on the pressure points here in between the shoulder blades. It's gonna feel a little bit cold until it warms up. Hi, Katie.
Hi.
My name is Dr. Matt. How are you feeling today?
I'm feeling pretty good overall.
Okay. I see here that you made your annual appointment.
Mm-hmm.
Okay. Can you please verify your last name and your date of birth?
Sure. It's ASMR and March 24th, 1989.
89, you said?
89, yeah.
Okay. Do you have any allergies?
No, not that I'm aware of.
Okay. And are you taking any medications on a daily basis?
No, not right now.
Okay. Have you had any surgeries since the last time I saw you?
No.
Okay. And any injuries?
No injuries. I do have a tightness in my neck, and it radiates down here.
Okay.
And I don't know if that's going to go away on its own, but it started yesterday. I was giving my puppy a bath, and I was just in this weird ankle trying to just like get certain corners of her while she was moving around. And I don't know why, but after that, just kind of like really intense strain whenever I move my neck.
Okay, so moving neck.
Yeah.
And how bad was the pain, or was it
It's
on a scale of 0 to 10?
like a 7. Yeah.
Okay.
It's very noticeable when I move.
Okay.
Mm-hmm.
And was it sharp? Was it radiating on one side more than the other?
It's like it gets really sharp, and it's just on my left side. It gets really sharp whenever I like turn my head and rotate it.
Okay. Are you experiencing any pain in your hands or feet?
No, I can feel it too. My shoulder, my upper shoulder, and then it stops.
Okay. Are you having any abdominal pain?
No.
Discomfort?
No.
Okay. Any lower back problems?
No, I don't think so.
Okay, and if you try to touch your chin with your chest like this, are you having any pain down the spine?
So, right when my chin hits here, it starts to hurt. Like right here. Yeah.
Okay, and is it traveling down the back?
It's just in that area on the left side.
So
That,
still
yeah.
localized. Okay. There you go. I'm going to take your temperature. This will go on your forehead. And this will go on your index finger. We're going to do a very thorough checkup, make sure that we have all the vital signs. Good. And I'll take your blood pressure. Go ahead and use this in. I'm going to have you uncross your legs. You do have a tendency to have low blood pressure, so let's see how it looks today. Okay, blood pressure is 108/65. It's not too low, so that's a good sign. And oxygenation is 98, heart rate 72. All vital signs look very good. I do not have any concerns. Okay, I'm gonna have you change in this gown, and we're gonna go ahead and begin the examination.
Sure.
So go ahead and have this closing in the back.
In the back. Okay. Great. I'll be right back.
I'm gonna go ahead and take some measurements. So we're going to check head circumference, making sure that everything is symmetric. And I'm gonna go ahead and check your arms as well. Perfect. And I'm gonna have you put your arms like this for me. Okay, very good. I'm gonna have you close your eyes, and can you please tell me if this feels equally on both sides of your head? Do you feel that equal?
It's hard to feel it at all, actually.
Okay.
Yes.
Okay. Go ahead and tell me when You don't feel the vibration anymore?
No. 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 No.
Okay. Go ahead and tell me which position here is louder. This is position number 1 or 2.
2.
And this is position number 1 or 2.
2.
Okay. Doesn't seem to be any problems there. What I'm going to do now is I will gently tap on your face. Let me know if you feel any kind of pain. We're trying to see if we can elicit any type of neurological responses. Okay, so that was 1. Every time we keep on tapping on the face, we're waiting to see if there are any movements, and it should be less and less as we keep on tapping. All right, go ahead and relax. Good. Perfect. Okay. Okay. Diminish response on the left side. Good. Good. Okay. I'm going to touch your face with 2 objects in the same time. I'm going to need you to tell me if you feel them equally on both sides, okay?
Okay. Yes. 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 Yes.
Okay. And now I'll touch you with 2 objects. One is going to feel sharp. Go ahead and extend your palm for me. I'm going to show you what sharp is going to feel like. And the other one is going to be dull. Okay?
Cool.
So go ahead and tell me if you feel this sharp or dull.
Sharp. Dull. Dull. Sharp. 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 Dull. Dull. dull, sharp, 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 dull, 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 dull.
Okay. I'm going to go ahead and palpate your head. So we're looking for any lumps or asymmetry. Okay, I'm gonna have you turn your head this way. We're feeling lymph nodes as well. I'm going to check your arms as well for any swelling. Okay, go ahead and open your eyes. I'm going to have you look straight at my nose. I'm going to flash a light in your eyes. We're looking for pupil dilation and constriction. Okay, I'm going to have you Follow the light with your eyes only, don't move your head. Okay. Very good. Now go ahead and look right here for me. A little bit higher. Okay. Going to palpate your sinuses. Looking for any swelling. Check hydration. Gently pressing down, see if there's any redness. Slight edema. Okay. I'm going to listen to your heart and lungs. I'm going to take this, put it over here. Is it okay if we open 2 of these buttons?
Yes.
Okay. I can hear a slight murmur. Also S1 and S2, but I'm a little bit concerned about that extra sound, so let's go ahead and check with the diaphragm as well. Yeah, we're gonna need to do further testing for that murmur. Go ahead and take a deep breath in and exhale. And again, take a deep breath in and exhale. Okay, go ahead and take a deep breath in and hold it for 1, 2, 3. Breathe out. Let's do that one more time. Take a deep breath in and hold it for 1, 2, 3. Breathe out. Okay, I'm going to check for jugular vein distension as well. And we're gonna have to listen to see if there is any external sound, any brewy, which is an indication of some circulation problems. Go ahead and take a deep breath in and hold it for 1, 2, 3. Breathe out. And we have to check on both sides. Take a deep breath in for 1, 2, 3. Good. Okay. So I would like to check your back now. I'm going to have you turn around facing the window there. Let's go and close those. Okay. Okay, I'm just going to put your hair up and we're going to take a look at your spine. Okay. Open the gown in the back. And I'll start by palpating mastoid bones, which are right behind your ears. Feeling for any swelling, any edema, signs of inflammation. Moving down to the first occipital bone. And here we're going to make some movements as I'm palpating your neck. I want to see how the muscles are working together and if there is anything popping out as you're moving your neck, okay? Go ahead and touch your chin with your chest. Very good. On the left side? Yeah. Alright, so we're going to make a scale. It's going to be from 0 to 3. 0 is no pain, 3 is a lot of pain, 2 a little bit less, and 1 not so much pain. So right now on a scale of 0 to 3, how would you rate this? Okay. Go ahead and come back to normal. And now try to touch your left shoulder with your left ear. What number is it?
That's 0.
0. Okay. Let's do the same thing on the other side. What number is that?
3.
3. Is it on both sides or just one?
It's just on the left side, and it's like right down here. So it's not as far as it's like right down like inside my shoulder.
Okay. Okay. Come back to center. All right, I'm going to have you lift your left arm up 90 degrees with your body. Go, go, go. Perfect. Okay, so now it's smoothing this side up. And I'm feeling a lot of tightness in this area. Very little spine mobility as you moved your arm up. Okay, bring it back down. And we'll do the same thing on the other side. How's the pain now?
It's not that bad because you're touching the other side. It was really painful here, but not here.
Okay. Okay, go ahead and bring it back down. And what I'm gonna have you do now is to try to make an S with your spine. So you bring your shoulders forward. Perfect. Okay. So we're taking a look at the spine, see if there are any abnormal curvatures. And right at T1, your spine is shifting to the right side. So that makes a lot of sense why you're feeling all of that pain. And it's right in this area. So your spine goes straight, 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 normal curvature, and then boom, shifting to the right side, right over here at the junction between the cervical and thoracic. Come back to normal. Okay. And it's not so evident as you're sitting like this. It's more evident when you lean forward in that position. All right. We're going to tap on your spine, see if there is any kind of pain as I'm doing that. And let me know if you feel any kind of shooting sensation down the spine, especially here as we're approaching that space. Yes. Tell me when it stops, okay?
That's when it stops.
Right here.
Yeah.
Okay. Go ahead and tell me if you feel this sharp or dull.
Sharp. Dull. 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 Sharp. 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 Dull. 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 Sharp. 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 Dull. Sharp. Dull. Sharp. I couldn't tell. Dull. 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 Sharp. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. 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 Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull. Dull. I couldn't tell. Sharp. 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 Dull. Sharp. 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 Dull. Dull. Sharp. Dull. 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 Sharp. 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 Dull. Dull. Dull.
Okay, very good. Right. Okay, I'm gonna have you lay down and I would like to take a look at your scalp
Okay.
and see if there is any sensory problems there too.
Okay.
Go ahead and take a look at your hairline first. I'm not seeing any redness. Some alopecia on the right upper side, and there's no sign of hair lice on the left side. Can you go ahead and tell me if this feels cold or warm?
Cold. 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 Warm.
Okay, does this feel cold on all three parts? That's 1, 2, and 3.
Definitely 1 and 3.
And this doesn't feel cold.
A little bit, yeah, it does.
Okay, go ahead and tell me if this feels sharp or dull.
Sharp. Sharp. Dull. Sharp.
Does this feel sharp all the way?
Yes.
Does this feel sharp all the way?
Yes.
What about now?
Yes.
Okay. Does this feel sharp or dull?
Dull. Dull. Dull.
Does this feel cold or warm?
Cold. Cold. Cold.
Go ahead and tell me if this feels sharp or dull.
Dull. Sharp. Sharp.
Wait for me. Does this feel sharp or dull?
Sharp. 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 Dull. Sharp. Dull. 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 Sharp. Dull. Dull. Sharp. Sharp. Sharp.
Okay. Does this feel cold or warm?
Cold. 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 Cold.
Okay. Go ahead and tell me if you feel this cold or warm.
Cold. Cold. Warm. Warm. Cold.
And does this feel sharp or dull?
Dull. Sharp. Sharp. Warm. Sharp.
Okay, is this cold or warm?
Cold. Warm.
Is this sharp or dull?
Dull. Sharp. Sharp. Sharp.
Okay. And does this feel sharp all the way?
Yes.
Okay, very good. All right. I'm gonna have you sit up. Okay, good. There were some problems with your scalp, and also I heard a murmur on the heart. Sounds a little bit concerning, but let's go ahead and just make more checks, more tests, and see if we come up with a diagnosis. The good thing is that you're feeling good right now, so you don't feel any problems with your heart. And also the neck and shoulder pain is a little bit concerning, so we're gonna send you for some x-ray just to double check and see if there is any deviation or need for surgery or anything like that. All right, and I'll let you know, and we're going to have a consult with a neurosurgeon. And for the scalp area, I just recommend some exercises for now to make sure that we stimulate and we bring a lot of blood flow to that area, okay? So the problem that I noticed more was on the right side.
Okay.
Right upper side. Okay. Seems like I'm throwing a lot of things at you right now. I'm so sorry. Do you have any questions for me?
It seems like a lot. Is there a chance that the heart issue is minor or that, it sounds like it could be serious? Just worried.
Heart problems, yes, they can be something that we definitely need to address. I can't tell right now how serious it is.
Okay.
Sometimes people are born with a murmur and they've had it all their lives and they don't know about it. And sometimes you can come to check up, hear the murmur, and go to the next one and not even hear any murmurs.
Okay.
So that's why I'm saying it could be something, but in the same time, let's just not jump to any conclusions.
Okay.
Do some more checkups and see if it's indeed something to be worried of, okay? I'm not worried about it right now, so don't be worried yet. Okay. All right. Perfect. Well, if you don't have any more questions, I'm going to let you get dressed and I'll see you up front.
Okay, thank you.
I hope. I'm gonna go ahead and put gloves on. I'm going to take a look at your face first and your scalp. In today's session, I'm going to examine your face very detailed. Go ahead and use my light here to take a look and see what's been happening. I read in your file that you've been struggling with sleep and acne. Then we're definitely going to check and see what kind of deficiency you're having. Taking a look at the hairline, I'm noticing clusters of red patches. That could indicate inflammation and maybe even some allergic reaction. Did you change any products lately?
I tried a new hair product.
Okay. Yeah, that could cause some of this issues and reactions. Have you noticed any increased itchiness or scaly patches?
Yeah, I've noticed some more itchiness and dryness than usual.
Okay, taking a look at your forehead. I would say that your liver is working properly. I'm not feeling any inflammation in the sinuses. And taking a look at your cheeks right under your eyes, this is where we would have another issue, but I'm not feeling anything inflamed. And we're going to check left side as well. We're definitely going to use some pressure therapy to maybe increase some of the blood flow. There's no cyanosis around the mouth. I'm not seeing any signs of dehydration. Lips are moisturized. There's no discoloration. They're pink. And the skin around it is blanchable. Okay. I'm going to start with some pulling therapy. It's going to allow the blood flow to be restored in some of the areas where we usually don't use those muscles that much. So I'm going to start by focusing on the lower side of the jaw, right under the bone area. And you're going to feel like a pulling sensation that allows for blood flow to be restored and release. This also helps with any tension that you were accumulating in our jaws. It helps to increase blood flow to the TMJ area. We're going to use some pressure under your eyes to move those muscles up. I'm going to lift your jaw up and move it this side. take some measurements to check for asymmetry. So you're gonna feel me touching you. It's going to feel kind of cold and like a metal. There you go. Okay. And now we're going to check inflammatory markers. Okay, slight asymmetry between right and left. So we're gonna have to work on these muscles right here. You're gonna feel some slight pressure. Trying to feel for any imbalances. Going to take some more measurements. This helps with any pain that you're having in the TMJ area, any tension. It helps to break the fascia and restore blood flow to the area. And so I'm going to activate the hairline. So I'm going to go ahead and check your scalp. So we're looking for signs of inflammation that are deep embedded in the scalp area. I am noticing some of the hair follicles that are a little bit inflamed, some redness, and it's the same issue that you're having on the hairline in the front of your head. So that really helps to establish a diagnosis. On the left side, there's definitely more redness compared with the right side. Just going to take a look at the hairline at the base of your skull. Okay. There's some dryness. I'm going to go ahead and take a sample of it. Take some measurements at the base of the skull. gonna feel a little bit cold.
Hi, Vanessa. How are you?
I'm good. How are you?
I'm good. My name is Dr. Matt. I'm going to do your sensory exam. Can you please verify your first and last name
Yeah, Vanessa Jones,
and your date of birth?
April 15th, 1997.
Okay, very good. I'm going to ask you some questions. I know that you're complaining of some sensory loss. Okay, can you please tell me where exactly that would be?
Yeah, a little bit like on my arms, like mostly on the left side, and then just like a little bit like in the like this area, like knee area.
Okay, so left upper arm and middle, and also right leg. And for how long have you been having this issue?
It kind of comes and goes, but I've had it for like maybe like a little over a month.
Okay. Any hypersensitivity anywhere on your body?
No.
Okay. Have you noticed any vision problems, any changes with smell, taste, or hearing? Okay. I'm still going to test those just to make sure that we're not missing anything. And I'm going to ask you to cover one eye. And with the other hand, can you please hold this chart? Actually, let's do this side. Perfect. And can you read this row?
428365.
Okay. And what number do you see here?
That's 8.
Okay. What number do you see here?
9.
Okay. Can you please tell me which circle is smaller, 8 or 9?
8.
Okay. Go ahead and switch eyes. And same thing. I'll have you extend this all the way. And now can you please tell me if you see this E on the right or left?
E's on the left.
Up or down?
Up.
Right or left?
Left.
And what letters do you see here?
X, X, O.
Okay, very good. And can you please close your eyes? What does this smell like?
It smells like lavender.
Okay, good. And I'm going to put one drop on your tongue. I'm just going to have you open your mouth. What does this taste like?
It tastes like a little salty.
Okay. Okay, can you please tell me on which side do you hear this sound? Go ahead and close your eyes.
Left. Right. Both.
Okay, and how many times do you hear this click?
3. 1.
Okay. Now I'm going to go ahead and test how your body perceives the painful stimulus. So I'm going to touch you with a sharp object. Can you please close your eyes and extend your palm? Perfect. This is what sharp is going to feel like. Okay. So I'm going to have you just put your arms around you like that and tell me if you feel this sharp.
Yeah. Sure. Yeah. Mm-hmm. Yeah. Mm.
And do you feel this equally on both sides?
I feel the right side a little bit more.
Okay. Okay. Now I'm going to combine sharp with a dull sensation. This is what dull is going to feel like, and this is what sharp is going to feel like. Go ahead and tell me if you feel sharp or dull. I'm going to focus only on your arms.
Sharp. Dull.
Okay.
Sharp. Sharp. Dull. 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 Sharp. Dull. 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 Sharp. Sharp. Dull. Dull. Sharp. 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 Sharp.
Okay. Go ahead and tell me if you feel this equally on both sides.
The right side a little bit more. Equal. And right side. And both. Right side. Equal. Equal. Equal.
Okay. Go ahead and tell me if you feel this same on both sides.
Right side.
Let me do it first on both sides and then tell me.
Left side a little bit more. Equal. Right side. Right side. Right side.
Okay, so there's a generalized sensory loss on the left side. Okay, I'm going to touch you with two objects now. One is going to feel warm and one is going to feel cold. Go ahead and tell me if you feel warm or cold.
Cold. Cold. A little more cold. Cold. More. Cold. Warm. Cold. 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 Warm. Both cold. Cold. Warm. Cold. Cold.
So there was some temperature problem there on the left side more. Okay, I'm going to check your position sense now. So I'm going to ask you to try to hold your arm this up, good. And I'm going to move your thumb up and down. So I need you to tell me if you feel it upward or downward.
Up. Down.
Okay, let's go ahead and check the other side too. Give your
arm up,
up, down, up, up.
Okay. Okay. Everything looks normal with the position sense. And I'm gonna go ahead and check vibration. I'm going to use a 256 hertz tuning fork. I'm going to create a vibration. I'm going to ask you to tell me if you feel it equally on both sides.
A little bit more on the right.
Okay. On which side?
Left side.
On which side?
Right side.
Do you feel that equally on both sides?
A little bit on the right. I can feel it more.
Okay.
On the right.
Tell me when this vibration stops.
No. No.
Okay. Tell me when. Did it stop?
I think it did.
Okay, let's try them again. Do you feel that?
Mm-hmm.
Okay, tell me when it stops.
No.
Okay. Same thing. Tell me when you don't feel the vibration anymore.
I don't feel it.
You don't feel it? Okay. I'm gonna have you turn around and I will examine your back as well.
Okay.
I'm gonna go ahead and put your hair up. Okay, and I'm just going to first visually take a look, looking at spine and symmetry in the back. Normal color. I'm not seeing any deviations. Is it okay if I palpate your back?
Mm-hmm.
Okay. Just feeling for the spine, checking to see if there's any abnormal curvature. No signs of any spinal deformity. Okay, can you please tell me if you feel this equally on both sides?
Yeah, I can feel both sides.
Okay.
A little bit more on my right.
Okay.
Even. A little bit more on my right. More on my right. Even.
Okay. I'm going to tap on your spine to see if there is any abnormal reaction, movement. Okay, so there was a little bit of movement here in between the shoulder blades. Any pain?
Mm-mm.
Okay. Okay. One more here. Was that any pain?
No.
Okay. I'm going to touch you with two textures. One is going to feel sharp. This is what sharp is going to feel like. And the other one is going to be dull. Can you please tell me if you feel sharp or dull?
Oh, dull. 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 Sharp. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. Dull.
Okay, go ahead and tell me if you feel warm or cold.
Warm. Cold. Cold. Warm. Warm. Cold. Cold. Warm. Cold. Cold. Warm on the right side, cold on the left.
Okay.
Warm. Cold. Warm.
Going to listen to your back. Okay, can you please take a deep breath in and breathe out? Again. Okay, Vanessa. The left side, there's a little bit of hypersensitivity and sometimes even sensory loss. So on this side, for example, there was a little bit of more sensory loss, and then as I went on the other side, there was some hypersensitivity. And I think we're gonna have to redo a repeat neurological exam, so another sensory exam in a week to see if there is any big
change, and if there is, then we're going to send you for some tests.
Okay.
Okay? Do you have any questions for me?
No, I think I'm good. Thank you.
All right. Since you're not having any pain, I think it's okay for you to go home and come back in a week.
Okay, thank you.
Thank you so much. See you soon. Hi, Caitlin.
Hi.
How are you?
I'm really good. Thank you for asking.
Okay, great. So let's go ahead and verify your last name.
It's Wilder.
Okay. And your date of birth, please.
October 3rd, 1997.
Okay. Can you please tell me today's dates?
It's going to be February 20th,
Mm-hmm.
2023.
Perfect. All right. And I see here you're for your annual checkup. All right. Perfect. Do you have any concerns?
No.
Okay. When was your last checkup?
I think it was a year ago.
Okay. Are you taking any medications?
Just birth control.
Okay. I'm going to ask you some questions just to make sure that I'm getting the right image and we have everything on file for you.
Okay.
Your last menstrual period, the first day of your last menstrual period. Do you remember?
I would say 3 weeks ago.
Okay, let me pull up my calendar here. Okay, so it was about January 10th.
Yeah.
Sounds right. Okay. And do you remember when you first had your first period?
I was 13.
13. And how many days does it usually last?
I would say 6 or 7.
6 to 7. Okay. And usually how many days in between periods?
I would say like a month.
It's like 30 days?
Yeah.
Okay. Have you noticed any recent changes?
No.
Okay. Are you currently sexually active?
Yes.
Okay. And sexual partners are men or women?
Men.
Okay. And your method of birth control is
The pill.
the pill. Okay. And for how long have you been on that?
Since I was 19.
Okay. And have you ever had an IUD?
No.
No. Okay. When was your last pap smear?
It was last year.
Okay. Well, we do not have records of that, so I think I would like to do one more on this visit. Do you remember the result of it?
It was normal.
No. Okay. And have you ever had an abnormal pap test?
No.
Okay. Do you do breast self-examinations?
No.
Okay. Okay. Have you ever been pregnant?
No.
All right. Any family history of diabetes, stroke, heart disease?
Only high blood pressure.
Okay. And is that from father's side or mother's side?
Mothers.
Mother's. Any history of high cholesterol, hepatitis, TB?
No.
Okay. Do you smoke or have you ever smoked?
No.
Okay. And do you drink alcohol?
Yeah.
Okay. How many drinks per week?
Probably like 2.
Okay. And do you exercise regularly?
Semi-regularly.
Okay. How long and how often would you say?
I would say I go to the gym like twice a week. And I use the treadmill for 35 minutes.
Okay. And are you taking any calcium supplements?
No.
Okay. Any vitamins, multivitamins?
No.
Okay. Okay. Are you an organ donor?
I'm actually not sure.
Okay. Any history of high blood pressure for you or diabetes?
No.
Okay. Any thyroid disease?
No.
Have you ever had a mammogram or a breast exam?
No.
Okay. Any hospitalizations?
No.
Okay. And do you have any immunizations against flu, pneumonia, hepatitis, or tetanus?
I've gotten my vaccines. I'm up to date.
Okay. So, all of them?
Mm.
Okay, I believe we have everything in order. So what I'm going to do now is I'll have you change in this gown right here.
Okay.
All right, and I will come back and I'll take your vital signs and we'll do the breast exam and the pelvic exam as well.
Okay.
Okay,
Thank you.
you're welcome. Okay, I'm going to go ahead and apply gloves. And I'll take your vital signs.
Okay.
Have you noticed any pain anywhere in your body?
I do have a little bit of pain. It's in my lower abdomen.
Okay.
It feels like it might be my uterus or my ovaries
Okay.
in that area.
All right, I'll definitely take a look. Any fevers in the last 48 hours?
No.
Okay. Okay, I'm going to put this underneath your tongue. Okay, can you hold this for me? And I'll take your oxygenation level. Good. 35.5 Celsius. It's very normal. Okay, and I'll take your blood pressure. Is this arm okay?
Yes.
Okay, relax. Can you please uncross your legs for me?
Okay.
Okay, blood pressure is 110/65. That's normal. And heart rate is 88. Oxygenation is 96 percentile on room air. That's also good. I'm going to listen to your heart and your lungs. I want to take a baseline, make sure that there's nothing else wrong with you, and we're going to then not repeat the same process next time. So just this time I'll listen to your heart. Okay. Is it okay if I put the stethoscope underneath your shirt?
Yeah.
Okay, can you take a deep breath in? Breathe out. Again, take a deep breath in. Breathe out. Okay, listen to the slides too. Take a deep breath in and breathe out. Good. On this side. Take a deep breath in and breathe out. Okay. Okay, bilateral sounds are normal, and only S1 and S2 were heard. Alright, I'm going to go ahead and examine your breast now. So what I'm looking for is for any discoloration, any lumps, and any asymmetry. Okay? I'm going to have you open the gown and I'll examine you. Thank you. Okay. Alright, so first I'm visually inspecting both breasts. They look symmetric, though the left one looks a little bit bigger than the right one, which is definitely normal. And I'm not seeing any redness. Okay. Looks very good and healthy. Alright, is it okay if I start palpating? I'm going to start from the top and move down, okay?
Okay.
Alright, go ahead and relax this side. And you can go ahead and relax. Okay, so I'm starting with the clavicle, and I'm not feeling anything swollen above it. Moving down on the clavicle line, there is no tenderness. Okay, no pain. Good. Okay. Okay, now we'll go in a circular motion around your breast, clockwise direction. And I'm just going to gently palpate for any lumps, although most of the times lumps can be just hormonal and they come and they go as we go through the cycle. Sometimes human chocolate or coffee can trigger some of those lumps to appear. Okay, have you noticed your breast being more tender before your period?
A little bit.
Okay, is it a lot of pain or just a little bit of pain?
Just a little.
That's good.
Okay. I am feeling a very small pea-sized lump. Okay, it's medial to the breast and the chest area. I'd say it's about a 3 to 4 millimeters in diameter, so it's not too big. It is soft and seems to be moving, so that's a good sign. Okay, most likely it's just fluid filled. Okay. Alright, I'm going to go ahead and write a note about that. And is it okay if I palpate your armpit as well on this side? Alright, so I'm going to look for any lymph nodes. I'm going to have you put your hand like this. Perfect. So I'm going to use just 2 fingers here. If it's too ticklish, let me know. I'm just using them to palpate, just check for any lymph nodes. If it's too ticklish, let me know, okay? Okay, very good. Alright, I'm gonna have you relax and I'll check your other breast now. Alright, I'm gonna have you relax. Same thing, I'm starting with the clavicle and move down. I'm not seeing any redness, nothing swollen. Okay, and now I'll move down the breast area. Okay, good. And on the lower side. Okay. And is it okay if I check your armpit area as well? Okay. Alright, I'm gonna have you do the same thing. Put your and behind your head. Perfect. Okay, good, perfect. All right, so what I'm going to have you do now is I'll have you lay down and I'll do an abdominal examination too. So what I'm going to do is I will just lift up your gown a little bit. And I'll examine your abdomen. Is it okay if I put the pants a little bit lower? Okay. Okay. I'll first listen. Okay, sorry, this is going to feel a little bit cold. Okay, very normal bowel sounds. Okay. Is it okay if I do a gentle palpation? Okay. Okay, I'm going to press down on your ovaries. Let me know if you feel any kind of pain.
I do feel a little bit.
Is it here?
It's the other side.
Okay. Okay, I'm not feeling any masses. So, ovary seems to be normal size. Okay, I'm going to go ahead and percuss. Okay, very normal sounds. Okay. So what I'm going to do now is I will do a vaginal examination. I'm looking for any lumps, again, any asymmetry, any painful parts, let me know, okay? But this should not be painful in any way. So I'm going to go ahead and first inspect, all right? I'm going to lift up the gown and take a look. And every move that I'll be doing, I'll tell you before I'm doing it, okay? Alright, I'm not seeing anything abnormal so far. No discharge, no redness, discolorations. Okay, and I'm going to use a speculum here to open open up the vaginal canal. Good. Okay. So that might have felt a little bit cold. Okay. And what I'm going to do now is I will do a swab. We're going to test for any infection. Okay, and one more swab. Now this is going to touch the cervix, so it's going to feel like a burning sensation. Okay, we are done with that one. Now I'm going to do one more swab, and we're going to test for any STDs. Okay, that was it. Now you might experience a little bit of spotting or bleeding, but it should not be more than just a drop. If you experience anything more than that, give us a call, okay? Alright, now I'm just going to go ahead and do one flush with normal saline. Good. Perfect. Alright, so I'm going to have you get dressed and we'll discuss the results.